imagine, medicine is dear to my heart because I've practiced it for over 30 years. And this bill doesn't really solve the problem, which is insurance costs and affordability, which is the main problem that it's supposed to address. What this bill really does, and I'm also against it and would vote to repeal it, what it really does is it's going to cost more money to the people, and it's going to give you fewer services and at a quality which is less than the quality we get now. Now people say, well, why is that? You know, that sounds ridiculous. Why would they do that? Well, the main reason is when the government does anything, it becomes more inefficient. You cannot tell me one government-run policy that runs efficiently and isn't broke or in the red. Medicare, Medicaid, Social Security. And I would challenge my professor here to give me one that's worked at all. And they don't work. They all go broke because the politicians keep spending more money. So what we need to do is repeal that bill, whether we can repeal it with the votes in the legislature and then override a veto or have a president in 2012 that will sign it, whether we rule it unconstitutional, which is being challenged in the courts now by the states and the attorneys general in multiple states, or whether we just decide not to appropriate the money for it so it becomes defunded. Whatever we decide to do, we have to do. And we have to approach this now as a piecemeal type of legislation. We attack the areas that need reform, not just give the government control of everything. So it's like a gunshot, approach to what you can use with a revolver. So what you need to do is first you have to attack the tort problem, which is the malpractice problem. There's no question there are states like Texas and California that institute tort reform, and their malpractice rates have decreased by an average of 20%. We can do that, and we can lower the cost of malpractice to doctors by at least 20%. That, in turn, is translated to the consumer as a lower price. We can do tort reform as number one. We can do it, how do you get insurance cheaper and more affordable? You do it by the free market enterprises. You do it by solutions that are based on capitalism. You can sell insurance across state lines. You have buying pools. You have high-risk pools. You encourage the use of health savings accounts so people can decide how they choose their medical care and how they spend their money. Those are free enterprise ways of doing it that work much better than the government coming in and saying you've got to buy insurance from one of these government-approved agencies. Because what's going to happen is you're all going to get insurance, you all get coverage, but it's going to be the lowest basic coverage you can get. You're not going to get this high quality you have today because the insurance companies and the government cannot afford it at those low prices.